Even though I have CF, I didn't want it to limit where I went, but I wanted to be far enough that I could still be independent and by myself, but close enough where I was able to come home for doctor's appointments I could. My biggest concerns were being able to get my medication, because it was so far away from where I was from that I wasn't sure how I was going to get everything on time. But even though my school is 4 hours away, my CF care team is very good about me coming up when I can as opposed to when I have to. They work their schedule with me, so I'm able to stay on track with everything I need to be on track with.
My primary concerns when deciding where to go to college were proximity to the healthcare team and my accessibility in both my routine visits and my emergency visits.
Wherever I went, I was going to have to be able to manage cystic fibrosis. I was going to have to know doctors in the area, or if I could commute to my regular clinics.
I wanted her to go away to college. I was very excited. It's a fun time for people her age, and it didn't matter to me where she wanted to go. I would support her if she wanted to go to any state.
And in my case, I was worried about him getting the medications, but also a doctor in case he got sick down there, and it's 4 hours away, and his getting back up here, would that be an issue? He didn't have a car at the time. So I hunted up the doctor, the person in charge of the infirmary there, and had a conversation with him so that I could figure out what we needed to do and have a plan.
Most institutions will have more or less of the same kind of information to determine eligibility for accommodations. That's always going to include medical documentation, substantiating and/or verifying the need. And once we get that letter, that statement from the healthcare provider, then we require, in our particular institution, a process called registration, and that's just getting data, emergency contact information, talking with the student about what kinds of compensation strategies they've used over the years that they found to be successful, as well as getting an understanding of what other kinds of support services we may be able to offer and/or provide.
One of the most interesting things that they offered that we never would have imagined is a note-taking service. And so in each of her classes, she has the opportunity to have a designated note-taker.
Some of the accommodations that I asked for were extra time to complete work in case I had doctor's appointments or needed to be hospitalized. I let my teachers know that sometimes I might be tardy to class because it's difficult to get everything done in the morning with the extra treatments and medication.
Investigating, calling the institution, planning a visit as early as possible so that one can determine, is this a good fit for me? Not just academically, but livability. Can I live here? Is this a cool environment? And does it provide for me those kinds of things that I think will make life most comfortable?
To learn more about this issue, ask your CF Foundation Accredited Care Center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.